We're worried specifically here about crush type injuries around the chest. That could be scapular fractures, spinous process fractures, sternal fractures, and rib fractures of different ages.
Hi, I'm Dr. Mason Vaillancourt, a PGY4 radiology resident, and I'm going to walk through one of Zauron's radiology cases with you today. Check the link in the description to follow along live with me. Let's go!
For this case, we have a bone survey for an infant. When evaluating these bone surveys, we're looking for osseous and soft tissue deformities that we can pick up on radiograph. The most common indication is an evaluation for non-accidental trauma or suspected child abuse. And as we move through, we're looking for fractures in the cranium. We look at the thorax. We're worried specifically here about crush type injuries around the chest. That could be scapular fractures, spinous process fractures, sternal fractures, and rib fractures of different ages. As we look, I like to look very carefully at the edge of my ribs and moving along posteriorly, not forgetting about my anterior rib shadows. As I move along here, I see on this posterior right rib some callus formation, and on the contralateral side, a little more laterally, I see another callus, suggesting these healing chronic type fractures. I'm looking for different ages of fractures, especially to continue to add supporting evidence for our concern of non-accidental trauma. But a rib fracture in this age should always be treated suspiciously, and if the flags aren't already raised, it's the radiologist's responsibility to assist our clinicians in raising those flags. A big part of the bone survey is continuing to look through each system, looking at the different projections of the ribs. We look to our extremities, looking for things like our metaphyseal corner fractures or bucket handle fractures, which we will see near the metaphysis, but we're also looking for long bone fractures, particularly in the lower extremities, where we're looking for those toddler-type spiral fractures in non-ambulatory patients who don't have a good reason to have that type of fracture. As we move down, here's an example of common area at the knees for our metaphyseal corner fracture and bucket handle fracture, which particularly raises our concern for high-velocity shaking type injuries whenever we see those pop up. And once again, our tibia and fibula, assessing for those spiral type fractures. This all clinically becomes very relevant, as I've seen many of my pediatric radiology staff weigh in and have to be involved in court cases and end up following up years later on reports they wrote and providing their expert medical opinion when called to comment on these cases. So we want to be thorough in our reports. We want to raise the suspicion appropriately and make sure that we're getting our clinicians the best info they can so they can help provide families with whatever support they need, and that we can continue to protect these vulnerable patients. So really important to be very thorough, to be specific, to not over-speculate in your report, but to be confident in what you're calling and in what you're seeing, because this is something that oftentimes comes back even years down the line, so you want to have a good base report to refer back to. Thanks for joining me for this teaching file. Now that we've gone through all the toggles, hopefully the abnormalities are a bit clearer. See if you can identify this abnormality in Zauron's companion cases and sign up for Zauron CME at zauronlabs.com/guardianlight. Study on.